Garbage. I'm Amber.
I'm Dana.
And today we're doing injections.
Yay.
Okay, so there are 3 types of injections. You have your intradermal injection, you've got your subcutaneous injection, and you've got your intramuscular injection. We are going to perform our intradermal injection on a live person.
Yay.
Dana is going to be our subject today. We'll do our sub-Q injection on a plum because it kind of has the softness needed. It's really the right feel if you're practicing. If this is something you do, if you're in the healthcare field, a nurse, EMT, paramedic, whatever it is you do, it's a good fruit to practice with for sub-Q. And then we'll do an orange for an intramuscular, which is a little tougher skin, which is going to show you how to, give you a better feel for doing it on that part.
Yep.
All right, so Dana, our good sport, is going to be doing a intradermal injection in her forearm. Intradermal injections basically go right underneath the skin layer, typically done for a TB test, which is what we're doing right now. You're going to want to hold it at about a 15-degree angle, and you're going to want to put the bevel up, and just, depending on how much you like the person, you might want to slowly do it. No, you're going to want to put that bevel up, and you're going to want to push the little injection, and it made a perfect little bubble, and it kind of went down, but it did make a bubble, and that's something we're going to check in 48 hours to make sure that Dana does not have TB. I'll put this in my sharps container, which is the safe way to dispose of sharps. You don't want to recap. All right, next injection we're going to do is a sub-Q injection. Sub-Q is usually done in the fatty tissue of the skin, and it's a little softer. You want to be careful for anybody who may not have very much fatty tissue. You usually want to go at a 45-degree angle. If there's not a lot of fatty tissue, if it's fine, you can stick it about a 90-degree angle. A lot of times what you can do is grasp with 2 fingers and pinch the sub-Q away. Yeah. And then you're not risking the chance of potentially putting it in the muscle, which is not where you want to do that. Sub-Q is usually going to be a little bit of a delayed release in the body. Insulins, I've seen biologic meds done in there, heparins. Make sure you rotate sites so that you're not bruising up somebody's poor little belly. Nowadays, I did read that some places are not using alcohol as much. I recommend if you're in a healthcare setting that you're going to use alcohol to make sure that site's clean. So you're going to rub a little bit, and then you're going to pull your injection however much you need. So we'll go at 0.3. You would then take your bottle, poke it in, squeeze your air, and then you would draw back up. After your skin side is nice and dry, you'll squeeze a little bit over, 90-degree angle, and squeeze your injection. Perfect. Make sure you get it in, pull it out, sharps container. Of course, after that, I will take my gloves off and wash my hands. A lot of facilities are also debating gloves, stating that as long as there is an intact skin and there's no risk of infection, such as an immunocompromised person, that gloves really don't protect from being stuck. They give you that sense of security, but it doesn't prevent finger sticks.
That's true.
All right. The last injection we're going to do is going to be our intramuscular injection, and for that we're using an orange, a little tougher skin. So again, we take out our alcohol, rub the site, and then take our little syringe here, draw up the air for what you need, take off your cat, put it into your bottle, inject, draw up. And for an intramuscular, you're going to want to go...
I was going to say, it's usually a larger needle, too.
Usually a larger needle, definitely. These are more used for insulin and TBs, which are very different. You're going to want a longer needle. And you're going to go at about a 90-degree angle, and you're going to want to firmly put it in, and then you're going to put inject. Then there you go.
That's my favorite one.
Yes. Take it out, put it in the sharps container, clean yourself off. A couple things I wanted to mention about injections is some of the sites that you can use. Usually for the intradermal, you use the forearm. That's usually given a TB test, although it can be placed underneath any skin. For a sub-Q injections, a lot of times you're going to want to use the back part of the arm is a good part. It's a little fatty part.
Thanks for that.
Although you're not.
I am.
You could also use the stomach. Again, you're going to want to squeeze and inject. You could use the side of the thighs, which you're probably not going to see right now, but the side parts of the thighs where there's some fatty tissue, multiple spots. Intramuscular, you're going to want to stick it to the deltoid muscle, which is right up here. Maybe for a larger injections, you could do your gluteus muscle back here. You just want to be very cautious. Sometimes I'll place my hand on the hip and make like a V, which will give you the specific spot. Always, if you're doing anything like this, make sure that you're trained and you've read your facility's policies. If you're at home doing this, make sure that the doctors or nurses give you correct training so you're not blindly doing this. You definitely don't want to get the wrong site. The absorption of the medication and what it's doing is going to be affected by that. So, anything else you want to share, Dana? I know I kind of talked over this.
It's okay. It was good. It was informative.
We're going to have another one, and Dana's going to talk to us about wound care. Dana is very good with wound care. She pretty much makes masterpieces out of those poor little skin tears and things that you get. She manages our wounds very well where we work, and she does a fantastic job. So she's going to come on back next time and do that with you guys, and I'm going to be quiet for a little bit. So a little change of things. We got a lot of stuff coming up. This was fun, so we enjoyed it, and we look forward to the next video where we get back to nursing and back to the basics and having fun.
All right, garbage.
Back to the trash. All right, thanks so much.
Bye.
Bye.